Nesta edição especial do Conversando de Coração, estamos aqui com dois colegas que vieram do American College para o Congresso da Sociedade de Cardiologia do Estado de São Paulo. E nós iremos conversar sobre um tópico extremamente importante, que é a qualidade de assistência aos pacientes e a qualidade de como nós podemos aferir a qualidade na realização de exames diagnósticos e de procedimentos intervencionistas. Vamos começar falando dos pacientes. Então vou perguntar ao Dr. Valentine como nós podemos aferir e por que nós devemos aferir a qualidade na nossa prática médica. So thanks again for staying here with us, for coming and sharing this time with us. It was very nice. But I'd like you to talk to us about quality of patient care. How can we assess it, and why should we bother to assess our own quality?
Well, we as physicians are dedicated to the care of our patients. It is important that we know how well we are doing in serving our patients, not only to the guidelines that we set for ourselves to practice, but also to our peers. How do we relate to our peers, and how well are we doing? We have been graded our whole lives, whether we were in grade school or high school or the university, and we have always done well, or we would not be physicians. It is paramount on us to understand how well we are doing now, and are we serving our patients with the same level that we have always sought. The way that we use registries are that we fill out data and we get feedback back that tells us how do we stand in relation to the guidelines, and how do we stand in relation to our peers in serving our patients. And it's critical, no matter what age we are, to continue to deliver the highest level of care to our patients that we can. The registries help us do that, and I have been involved in registries for 20 years, and I always love to get my feedback to know how I am doing, and am I improving every year.
So it's about getting better.
It's about getting better. This is not about my ego and whether I am good enough or whether it's all about improvement, continuous quality improvement, and that's what we're all dedicated to as physicians.
Exactly. We want to be better tomorrow than we are today.
Correct.
So a registry like Pinnacle, for example, would be very helpful in this kind of approach to medical practice, right?
Yes, the Pinnacle registry is an outpatient registry that helps us know how we are doing in relation to our guidelines for care for hypertension, for hyperlipidemia, for atrial fibrillation and anticoagulation, for all the different data points that we need to show that you're doing the right thing. Do your coronary disease patients have statins? If not, why? Is there a reason that you can document? Do your heart failure patients get appropriate ejection fraction testing? Are they on ACE inhibitors? If not, why? And it really allows us to judge ourselves and to see how well we are doing. And it's our own report card to let you know, are you making an A on every course?
And that's what you should try to.
And the same thing with our registries in the cath lab. Cath PCI and the Action Registry tell us, are we treating our patients in the cath lab with appropriate use? Are we doing the right things in the cath lab for procedures? Are we taking care of heart attacks in the appropriate way? Are our door-to-balloon times improving so that we save more lives? Mm-hmm. And if you measure people, we all improve just by measuring alone. And Dr. Hindle has proven this many times, that the Hawthorne effect, all you have to do is do the measurement process, and we all improve.
We know somebody's watching, so we try to perform better.
Yes.
Thank you very much for coming and for this importance.
Well, the ACC is grateful for its partnership with SOCESP, and we are grateful for our partnership with all of the Brazilian society, and it has really been an effective partnership, and we learn as much from you as you do from us. So that's what makes it effective.
We learn a lot and really appreciate your coming.
Thank you for having us.
É por isso que a SOCESP participa e estimula que seus associados tomem parte nos registros, para melhorar a qualidade, para que nós sejamos médicos melhores, que envolve outras partes da medicina, tanto intervencionista como de diagnóstico. Por isso que eu vou perguntar agora ao Dr. Bob Handel qual a importância e por que fazer essa avaliação de qualidade, até de uma maneira nossa conosco mesmo, para que nós possamos nos tornar profissionais melhores. Thank you, Bob Handel, for coming here with us. So what's your view on the quality assessment and the need for quality assessment in procedures and diagnostic procedures?
So certainly quality is something that we all believe in. Quality is something we've been talking about, but it's a lot harder to do and a lot harder to measure than just to say, I have quality. quality. How do you prove it? How do you improve, as Dr. Valentine has pointed out? And I think now we have metrics. We've learned through time, I think in Brazil and in the United States, that we must really have a threshold and a benchmark to compare ourselves in everything we do. Not only in test performance or in procedural performance like PCI, but also in how we evaluate the patient, what diagnostic treatments do we do, how frequently we do this, are we really doing what the guidelines tell us to do? I think it's very easy to say, sure, you do this correctly every day, I do this correctly, but until we're confronted with the information, we really don't know. And we have a lot of tools. We have many, many tools that have been developed both in Europe, in the United States, and here in Brazil that can help us optimize care. I think that's the key thing. When you talk quality, when you talk resource utilization, are we really truly optimizing what we do, improving patient outcomes, improving patient care? And I would say nowadays with a consciousness of cost. We have to recognize our resources. We have to save some of our more expensive technologies for the people that truly need them and are going to get the most benefit. That is quality, in addition to just having the outcomes too.
So instead of being afraid of being judged, people should use this quality control methodology to make themselves to practice a better cardiology, a better medicine. Is that right?
Absolutely. As we've talked about, we all want to improve. We all want to be the best. Well, not everyone can be the best, but we can certainly all get better than what we do. And I think that there's a learning curve. We've all come to meetings and we attend major conferences like SOCEP to be better. Well, how do you know you've actually learned? You know, taking the quiz at the end of a course teaches us. I think taking something and getting information like feedback from a registry is extremely helpful. And nowadays we even measure how we use appropriate use. We can track how you're using CT or nuclear cardiology procedures. Did I apply this to the right patient, or perhaps that test should have been applied to a different group?
So perhaps it would be a good idea to use those criteria even to discuss with the patient which is the right test for him or her to do, right?
Excellent point. I think the concept of shared decision making is something all of us are now really starting to learn. We've been listening to our patient advocates. On the board at the ACC, we even have a patient representative on the board to keep us in mind that we have to remember the patient. So whenever you make a decision about ordering a diagnostic procedure or perhaps performing an intervention, you should discuss the benefits and risks and involve them in the discussion, because I think nothing is absolute in cardiology. So we all have to weigh the benefits and the risks and engage the patient. And I think a lot of our guidelines and appropriate use criteria are there to help us talk to the patient with a meaningful approach.
Thank you very much. You've always been a good friend to Brazil and the society. Really appreciate you coming here.
Thank you.
Mais uma vez, a SOCESP está preocupada com a qualidade, e esse conceito que foi passado aqui é muito importante. Nós não temos que usar esses critérios para nos julgarmos ou sermos julgados, mas porque nós fazemos que todos nós